the presentation is titled Evidence-Based Interventions Wales, and I'll explain the reason for that as we go along. So currently, we've got what's known as interventions not normally undertaken, and these have been in place in health boards across Wales and indeed in England for many, many years. They are basically interventions, and what we mean by interventions is a bit of a catch-all title. So they're about procedures, they could be treatment programs, they could be devices. They're basically things that are non-medicine. And they are interventions where the evidence suggests very little if there's any health gain at all. They're usually considered to be low priority, and we don't usually undertake them unless there are some specific criteria. And this is because usually there's insufficient evidence of clinical or cost effectiveness, and they are considered to be of a relatively low priority for NHS resources. And as I go along, I'll explain to you what they are. So in terms of a bit of background where we are, so currently we've got 7 local health boards across Wales, and they've all got their own what we call INU list. So there's a lot of variation because those lists contain different interventions. Some health boards may have around 30, some health boards may have a lot more, and they've been in place for some time. There's unknown evidence base for the criteria used, and that's simply because back in 2007, there was an organisation called Public Health, and they devised a list. And since then, the health boards have changed. They've been regrouped since 2009, and the INU lists have altered, but the evidence base hasn't. So some of these have got quite old evidence, and that's changed since this time. The aim that we're trying to achieve now is a new all Wales one list that's completely up to date in terms of evidence. And we've got an organisation that's working with that to ensure some consistency then. So we've devised this group called the All Wales Clinical Effectiveness Group, or OCEG as we call it. And the group was established because we looked at all of the INU policies across Wales. We also looked at a piece of work that NHS England have been doing when they've called theirs an evidence-based intervention list. We've been looking at the best practice and how we can ensure that there's equity. And we've also been looking at how we sort of bring all of the evidence up to date with all of our clinical groups across Wales as well. So we're cutting this down into bite-sized chunks, and currently we've got what we call phase 1. So we're looking at 8 interventions currently. They are listed there. There's, and they vary, the interventions vary. So the first phase we're looking at is hemorrhoidectomies, carpal tunnels. We've got sort of grommets for glue ear, ultrasound shoulder injections, tonsillectomies. But there is a huge list, and there's a further 2 that's been added recently, which are to do with varicose veins and removal of gallbladders. So just to give you an idea on some of the process that we've been using, when we've reviewed the INU lists across Wales, we've identified 139 interventions that we need to review the evidence base for. And as these are reviewed, they will get added to the All Wales list. We're working with Health Technology Wales, which are an organisation similar to the AWTTC that review evidence for non-medicine interventions. They've been looking at the up-to-date evidence, including the stuff that's been done in England. They look at the clinical evidence and the cost-effectiveness evidence, and then they produce what we've called an evidence review report. We've got in place across Wales as well what we call clinical implementation networks. And these clinical implementation networks are made up of clinicians in different specialties. So for example, we call them CINs for short. So we've got an orthopedic sin, a vascular sin, general surgery. So there's lots of these across Wales that we share these reports with. And then that group of clinicians will also review that evidence and give us feedback in terms of what their views are. And then once we've agreed the criteria, we develop a patient information leaflet. And what I mean by once we've agreed the criteria, these interventions, we're not saying, we've changed them from what was called interventions not normally undertaken to evidence-based interventions, simply because by calling them interventions not normally undertaken, it gives the impression that it's something that we won't do, but we will. There's just certain criteria that needs to be met before we will do them. So an example of that could be tonsillectomies. It's not that we don't do them. There are criteria that need to be met. So it's things like, you need to have tonsillitis for so many times, which is documented and have tried over-the-counter medications and different things before we would consider a surgical procedure, because with every procedure, there are risks. So patients need to fulfill criteria before we get to the point where we provide a tonsillectomy for a patient. So just as an example, we've come up with some ideas around patient information leaflets, and we're mindful that we want to give them enough information, but we don't want to bombard them with information at the same time. So as an example, there's one for carpal tunnel. We thought it might be useful to include a diagram just to show, what carpal tunnel is. So it's basically a compressed nerve that would cause pain and inflammation, and then stop the patient then from having adequate use of their hand and give pain. And the type of information that we thought that we could put in a leaflet would be around, what is carpal tunnel decompression? Is there anything that you can do for yourselves in terms of self-help? What's the criteria for you having a surgical procedure to correct that? What would be the benefits of having that intervention or that procedure? What are the risks? What are the alternatives? And what if you decide you don't want a procedure and you do nothing? And then another example would be around varicose veins. This is an old one we produce, but we would sort of replicate it based on the new up-to-date information. And previous feedback from patient groups was that they sometimes like a picture or a diagram. So again, this would be around, what is a varicose vein? What causes a varicose vein? What can you do to help yourself? What can you avoid? And again, what the criteria would be if you were going to have varicose vein removal surgery. So in short, that's the piece of work that we're doing. If I just stop sharing now. So ideally, what we're asking from this group, if you would mind, is as we do these pieces of work and we develop these patient leaflets for each intervention, would this group be happy for us to share those leaflets with you and provide us with some feedback in terms of whether or not you think it's in plain English, whether there's further information you would like, or whether there's too much information in there? We would just really appreciate a patient or an independent perspective from this, so that we ensure that the information we're providing is targeted to the right audience and sufficient really for you to understand. Thank you.